Good morning. Welcome to Salina Regional's Morning Medical. I'm Mike Maddock from the Marketing Department at Salina Regional Health Center. This morning's program, we're going to be talking with Joyce Trower. Joyce is the Director of Infant Child Development at Salina Regional Health Center. Thanks for being on the program.
Thank you.
I guess we'll start out exactly, what is the Infant Child Development Program?
Well, we are an early intervention program serving primarily the counties of Ottawa, Ellsworth, and Salina for children birth to 3 who have developmental delays or disabilities. The services we provide would be physical therapy, occupational therapy, speech-language therapy, early childhood special education, social work and counseling services, nursing, and then some supportive services for vision and hearing in regards to getting those areas of the child's development evaluated and treated if needed. We also do some of the therapies, meaning speech therapy, physical therapy, occupational therapy, for older children in the community or in the region who need those services, maybe don't have those in their community or don't have someone who does pediatrics, say occupational therapy in their community, and maybe needs a hand splint or a sensory innervation program or some type of intervention in our different genres of specialization.
Are there any particular, maybe some recent trends that you're seeing?
We do testing that will help rule out the diagnosis of autism, where a doctor typically would be evaluating a child, might only see the child for 45 minutes or an hour, sometimes doesn't feel comfortable making that diagnosis in that little snippet of time of observing the child's skills. Autism in particular is a diagnosis that's made based on the child's level of functioning in social environments and with language. Now, a lot of people know a lot more today than they used to know about autism. But one thing I will say is certainly it's not a diagnosis that means that the child's not going to make progress. And there are all degrees of severity of that diagnosis. So if families see some of the symptoms of the child having language delays or social emotional skills that seem less mature or less engaged with the family or the caregivers, that's a reason for concern. And there are screenings at our Central Kansas Cooperative in Education, or they could just call us and we could do a free evaluation or a free screening.
All right. Thank you so much for being on the program today and for the tremendous services that you offer. For more information, please visit srhc.com and like us on Facebook for the latest updates and news.